Great. So I'll be talking about the co-production of a digital intervention to support opioid tapering in patients with chronic pain. My colleague Paul has just given a fabulous introduction for my talk in describing the difficulties with tapering people off opioids when it's voluntary, when it's what they want. But before I begin, I'd like to just quickly touch on the concept of co-production and why it's so critically important in research. Co-production means involving stakeholders, including patients, clinicians, and the health system itself in the understanding of healthcare problems, in planning of research, in undertaking of research, and in the evaluation of the research. And this is really important for several reasons, but it ensures that our research is relevant to consumers, relevant to things that they care about, not things that we care about. It ensures the feasibility of the research that we conduct, not only in the trial phases, but also in practice. It also ensures acceptability of the interventions that we develop. And this, of course, is really critical, because if we develop interventions that are not acceptable, it doesn't matter how efficacious they are. When we translate them in practice, they won't be effective because patients won't adhere to them. And so we really, especially in a very tricky area like reducing patients' reliance on opioids when they have chronic pain, it's absolutely critical that we use a co-production model. So that's what I'm going to be describing today and how we did that. So our journey began with an experimental study with patients at the Pain Management Research Clinic, where we we compared patients' attitudinal and emotional responses to different forms of pain management advice. And we found that patients with chronic pain in the tertiary pain clinic setting were satisfied, actually, more often than not, with advice to reduce their reliance on opioids when they were provided with alternative pain management support, such as multidisciplinary pain care. So that's really interesting and sort of maps onto what Sarah Helmer was saying earlier about many of her patients in her studies actually being very open to deprescribing, that if they had a choice, actually they wouldn't take as many of these pharmaceuticals. However, the complication was revealed in a qualitative study that we conducted, and this is the first longitudinal qualitative study of opioid patients tapering opioids for chronic pain, where we interviewed a sample of patients every week for 12 weeks, and we identified typical or prototypical trajectories of pain, distress, and activity interference over the course of a tapering period. What we discovered in this study is that actually patient distress while tapering is relatively common, and it is, importantly, it's related to the availability of informational and socio-emotional support for patients. So the support that people are experiencing while they're tapering is critical to the trajectory of their tapering experience, and the tapering trajectory is related to their ability to adhere to this tapering schedule and their quality of life during tapering. The problem, however, is that demand for multidisciplinary pain care and social support while tapering is at an all-time high, especially now with COVID, and particularly, and access to these supports is challenging, particularly amongst most vulnerable patient groups. And so it's clear to us that there are critical gaps in care that may undermine patients' goals for opioid reduction and contribute to patient suffering. And this is the need that we've recognised, and we need to find solutions to this problem. Some fabulous research by Clara Chow at the University of Sydney, but also an abundance of research conducted mostly in the US, has identified that digital supports for lifestyle behaviour changes and like diabetes management, cardiovascular disease, and also smoking, cessation of smoking, benefits from digital support. So we based on this model, we hypothesized that digital health technologies may provide patients with continuous support for pain and withdrawal symptom management during the tapering process. So that was what we thought based on the research. But of course, with a co-production model in mind, we need to know, more importantly, what do patients think about this? is it acceptable for patients to rely on digital support while tapering? So we recruited 21 patients with chronic pain who are currently tapering their opioids. And importantly, this group of patients was extremely diverse. So we had 55% women, age ranging from 29 to 83 years. We recruited patients from metropolitan, rural and regional areas, from tertiary and primary care, from diverse cultural and linguistic backgrounds, and variable income and education levels. And what did patients think? We found that 100% of the participants in our study were owned and used mobile phones regularly. 81% were interested in SMS-based support versus 71% being interested in app-based tapering support. And there was generally a higher level of self-efficacy for engaging with SMS versus app-based messages. What do patients want? So based on that information, we concluded that we were mildly surprised by this finding, but that's the benefit of co-produced research. We found that patients actually would prefer engaging with SMS over apps. And so, okay, now that we know what modality they're interested in, how do we, what kind of messages is it that they want to receive? And we found that patients were really seeking information about pain management strategies from these messages, information about what to expect while tapering from these messages, reminders about opioid-related harms, and reassurance, including validation and emotional support. Now, importantly, none of our patients said, we don't need a clinician anymore, we don't want to talk to our clinician. And in fact, it was really important to patients that if they did receive a digital intervention, it was provided to augment care from a healthcare provider. And so it's important to note that when we're developing this intervention, it is not to replace the role of the healthcare provider, but to augment and extend the role of the healthcare provider to provide support for patients outside of office hours. So we do continue to expect that clinicians will provide patients with information about pain management strategies, information about what to expect, and reminders about opioid-related harms, as well as validation and emotional support in the clinical encounter. However, as you know, when receiving, I'm sure you're aware or that you can imagine, when patients are receiving opioid tapering advice or being asked to reduce their reliance on opioids, emotions can run high. And that's something that we have found in our other research, that we've published. And so when patients are highly emotionally aroused, they tend to forget the information that is being given to them. And so it really, this underpins an extra reason why we need to have this digital support providing ongoing information after the consultation to remind people or prompt people about what was discussed in the consultation with their healthcare provider. So we now know what sort of information patients want, but then we needed to design the content, write the video scripts and the text message content. And so as a first step, we designed 200 text messages. We drafted a video script for patients, including key concepts and patient testimonies, which previous research had found was really important for increasing patient willingness or intentions to taper. We drafted a library of 200 text messages covering each domain of support that were suggested by consumers. And we drafted this library based on very popular pain self-management texts that are popular with consumers. And these are evidence-based strategies. We then went through a process within our team of selecting 90 messages from the 200 that we found were acceptable within our multidisciplinary clinical team, a research team, before then recruiting 12 patients and 12 clinicians to rate the content of the draft video script and the text messages. And based on this feedback, we then revised the video and selected 56 highest rated messages in response to feedback. So we end up with a video that is highly engaging and acceptable to patients, and that video provides like a framework of information for patients when they sign up for the text message support, and then they receive text messages thereafter. In order to figure out how many text messages per day patients should receive, and also to co-design our randomized controlled trial, our pilot randomized controlled trial. We recruited patients to pilot the process to ensure that the actual study of this intervention is also feasible for patients.
Claire,
So
I might just need to jump in to say we've gone a little bit over time. So if you could wrap up the slide, that'd be great.
Sure, no problem. So we co-designed the measures in the trial. We went with consumer recommended dosing of 2 messages per day for 28 days. And we received trial feedback on the methodology, and then we iterated messages. We're now in the process of conducting the trial, and the next steps will be to conduct a large-scale multi-site trial, including rural and regional areas, before looking at the applicability of this concept in post-surgical care and opioid tapering. Thank you.